Next part is actually two tests, but I combine them together because one doesn't tell you nearly the entire story without the other, and the other doesn't tell you the story without the first one. So it's very important to know that both of these two tests combine together and look more at the ratio between the two. The first is called T4, and T4 is tyrosine, an amino acid with 4 iodides attached to it. Okay, now T4, you want to know the free T4. The free T4 means that it's not bound to a protein that makes it inert. Okay, so the TSH is the first test. The second test we want to look at is the T4, the inactive hormone that's released by the thyroid gland. Okay. It does nothing. It always reminds me of the song by War, you know, what is it good for? Absolutely nothing. Well, that's what T4. T4 is really worthless. And when you have hypothyroidism, that's what they're going to give you. They're going to give you T4. So those out there that are on medication, but your symptoms haven't gone away, the reason being is because the T4 hasn't been converted into the T3. And what happens is T4 goes to the gut, and in the gut, which is what we call the duodenal system, you have the liver, you have the small intestine, and you have the pancreas. Now when T4 goes to the gut, it's converted into T3. Okay. That's the active hormone. That's the active thyroid hormone. It knocks off one of the iodines. Okay. And so what ends up happening is you have to look at the T4 free and the T3 free to make sure that they're in ratio, meaning that this one can't be high and this one low, because that tells us you have a gut problem. There's a problem with the conversion. Okay. Now, the liver, we all know, becomes damaged primarily from fat. And there's two reasons why fat damages the liver. The first reason is that we eat too much sucrose. Half the molecule of sucrose is fructose. The other half is glucose. Now the cells will consume the glucose, okay? But the fructose gets to the liver, and there the liver converts it into triglycerides, into cholesterol. And so this makes the liver to be very fatty. Okay. So that's one of the reasons we have that. And the other reason why it becomes fat is from alcohol. Alcohol is going to do that. So fructose and alcohol damages the liver, and that's one of the main reasons that T4 doesn't get converted to T3. We're next going to talk about what we want to look at when there's a problem with the small intestine. Now I want to take it a little deeper. Now we know that TSH is what conventional medicine uses to diagnose the hypothyroid, and it's actually measuring the pituitary gland, because that's where the TSH comes from. We also know that we're going to look at the T4 that's released by the thyroid gland, and we're also going to look at the conversion of the T4 to T3. That ratio tells us if the T4 is converting to T3. And also, if you're taking medication, which Synthroid and levothyroxine is nothing more than synthetic T4, if you're not converting it, you can take all the T4 that you want and nothing's going to happen. Your symptoms are going to remain. So now what I want to talk about, though, is something that most of you that have thyroid problems have. In fact, several of the patients today that I had come in actually had this problem, but no one had ever diagnosed it. And it's very easy to diagnose. It's a disease called Hashimoto's. It's an autoimmune disease in which your thyroid is being attacked by your own body. I'm going to explain how that happens. Now, you remember the T4 goes to the gut and is converted to T3. Well, one of the problems that we have is the bacteria that's inside of the small intestine. One of the bacteria is called the symbiotic bacteria. That's the good bacteria. It's like air. It's like water. We have to have it. In fact, research is starting to show that they're kind of the generals of the body. Their DNA tells our DNA what to do. The other bacteria is called commensal. Commensal is the bacteria, it's kind of like your neighbor. For example, recently my neighbor came, knocked on the door, and she asked me that she told me she needed some help. And I asked her what was wrong. She said, well, she was exiting out the garage before the garage door was open, and now she was trapped because she ran into the garage door. So I went over and I jimmied the garage door up, and we got her car out. It was more difficult trying to jimmy the car back down. Now, the reason why I even bring this up is the fact that I haven't seen her in months. But that one day she needed me, and ironically, she was trying to get to her doctor's appointment. That's kind of like commensal. They're the special ops. They're the bacteria that come in when you really need some strong bacteria to come in and do their duty. The last one is parasitic. Parasitic bacteria are, they're parasites. What they do is they live off of you. There's really no exchange. They take. They're like the thief in the night that comes and takes everything and doesn't even leave a note. Now, all three of these eat carbohydrates. They don't eat any proteins. They don't eat any fat. The symbiotic eats fiber. The commensal eats whatever they want. We're special ops. Okay, in the carbohydrate field. And the parasitic eats sugar. Now, my great-grandparents, they ate about 100 to 300 grams of fiber a day and about 5 or 15 grams of sugar. And so they fed the symbiotic. Now, today it's flip-flop. Today we eat 100 to 300 grams of sugar a day and about 5 or 15 grams of fiber. There is no fiber in a hamburger, milkshake, and french fries that we get from the fast food restaurant, okay? But there's 75 grams of sugar in one Frappuccino at the local coffee shop. So we feed the parasitic, and what happens is the parasitic overgrows. This is actually called a disease called SIBO, small intestinal bacterial overgrowth. Now, when this happens, we start having an eating away of the mucosal lining. And when the mucosal lining becomes thin, things start to escape. Can anybody tell me what the name of this disease is? Yeah, you're right, leaky gut. Now, things like bacteria, pathogens, and proteins will escape. One of those that gets all the publicity is gluten. Now, God made it so that around your intestines is the immune system. Also, the arterial and venous systems. They're all wrapped around there. Also, the neurological system. There is more neurons around your gut and the small intestine than there are in your brain. So it's actually the second brain. But anyway, let's say that gluten escapes and it gets into the circulatory system. It will travel up and get into the thyroid gland. And when it gets inside and it beds itself, the thyroid gland, it gets into other glands. I'm just using thyroid as an example. It likes the soft tissues. When this happens, the thyroid gland is going to release antibodies. Okay. And antibodies are nothing more than, it's a system telling the body, excuse me, danger, Will Robinson, danger. There's something wrong here. There's an invader, there's an alien within the gland. Now this signals the liver, and the liver is going to send the army. The white blood cells are going to attack the thyroid. Now when this happens, okay, the thyroid starts getting eaten away, and there's more antibodies that are being released. These antibodies we call TPO. Okay, they're thyroid peroxidase. Okay, and what we have to do is we have to measure that. We have to measure the TPO. If you do not know the TPO, if there's a high rate of TPO within your system, then you don't know that you have Hashimoto's, this autoimmune disease. And I'm willing to bet that if I find one autoimmune disease, I'm going to find other autoimmune diseases. And if you look at all the research from the Journal of American Medical Association to all of them, you're going to find that cancer and diabetes and heart disease and strokes and Alzheimer's and hormonal disruption, thyroid problems, obesity, the root cause is inflammation. Inflammation, today's chronic inflammation, is from our own body attacking itself.